Hey there, I'm CJ. I'm the certified sex and life coach who helps midlife women advocate for themselves, find their voice in advocating for their pleasure within healthcare, relationships, and dating. Today, I'm going to talk about menopause training for doctors, in particular for OBGYNs. Most of us know, if we're women, OBs are for having babies, gynecologists are for what's going on down there. Yet, there's been a study or a questionnaire to program directors of OBGYN programs. How many actually have dedicated menopause training? Just over 30% reported that they do. Okay, this is insane. Half the population will go through menopause, will experience menopause. Yet, doctors who are specifically treating women, people with uteruses, ovaries, vaginas, are getting 1 to 2 hours of training maybe in menopause. This is crazy. I don't know much about the medical field and training for it, but I used to get shocked when I heard that nutrition training was like minimal. And this is just even more shocking because half the population, we all need to eat, right? And nutrition is super important, but half the population is going to experience menopause. And there's so much new research going on right now. And right now is the time, if you're someone who's close to my age or, had access to or was told by older women in your family to stay away from hormones, you need to get on board with the latest research. I'm doing a half day, a 3-hour virtual retreat exactly on this, so you can get up to speed. Feel free to DM me, I'll send you the link. Anyway, we need to, as people experiencing perimenopause, menopause, or are recently postmenopausal, we need to get on board with the latest research. We need to learn how to have a voice. We need to learn how to get over the shame or the stigmatization of the topic of menopause. This is ridiculous, folks. What is there to be embarrassed about? We are going through this. Aging is so stigmatized in this country. It's really frustrating. I just went through a humiliating experience, honestly, in an interview that felt very much like, brought up feelings of shame because I'm an older person and I'm pretty solid, and it kind of shook me. So, I just want you to know that there's nothing to be embarrassed about. And if you don't speak up, you are not getting the care that you need. And that is really important. For me, and if you're in my world, you know this, pleasure is one of my top priorities. And if that's you, you need to stay tuned because, this is what I'm all about. I want to experience pleasure for the rest of my life. I have recently, within the last 13 years, really discovered what turns me on. And it changes too. There's I'm expanding. There's more things, right? There's more to discover about my body and what brings me pleasure and how I can interact with others. And I am not ready to let that go. I never will be ready to let that go. As long as I stay healthy and I feel good in my body. And that's what this is all about. I really want to be able to experience pleasure until I take my last breath. You might not be anywhere near that right now because you're just miserable, because you're experiencing hormonal changes, the chaos that is perimenopause, and then the whatever, just the fresh hell that is menopause, or can be for some of us. And pleasure is just so far off, you don't even remember what it was. You can still have it. You can still get to it. You can still go back to it. You just need to give this a lot of attention. And you need to get up to speed on what menopausal hormone therapy can do for you. And as I said, sadly, the medical professionals, even the ones who specifically care for women, don't have the training that they should in this area. Now, plenty of excellent doctors, wonderful people who are really advocating for this. Thank you all so very much. And we're in this I'm calling it the in-between, right? We're in this in-between where lots of new research is coming out, because also, research on women's health is far less than it is on men's health. So we're catching up a little bit, but there's still this in-between of we've discovered that estrogen therapies and hormone therapies actually have so many benefits to our aging process, to our health, to our well-being, to our mental health, that they far outweigh any potential cost for most people. Okay? I had fear around taking hormone replacement, and I don't anymore. I actually see it as part of my wellness and part of my longevity health. Hopefully it is contributing to my longevity. Protecting my brain, protecting my tissues, protecting my heart, all of those things are important. And for me, it all comes down to pleasure. So, doctors are not trained. Some doctors are wonderful. They're up on the latest research, but you need to learn how to have a very serious, pointed, and educated conversation with your doctor so that you can get the care that you deserve. And you might have to get a referral to somebody else. You might need to see more doctors than you are currently seeing in order to get that help, right? And I have a 3-hour virtual retreat coming up on August 3rd. DM me for the link. You will learn the latest research, what menopause is doing to your body, why it's important to get on board, even if you're not experiencing symptoms, but let's say you're in your late 30s, early 40s on up. Please DM me for the link. I'll send it to you. Take a look, see if it resonates for you, because this is important for half the population. It's important for us to be educated and to gain confidence around having appropriate conversations, productive conversations with our doctors. And it doesn't mean it's a one-off. Menopause and hormone replacement can be tricky. I have had to tweak things a few times. So you need to be able to have these conversations with your menopause care team. And I want you to have a menopause care team because you deserve it and because pleasure is possible. And you can stack the deck for a more positive aging experience. I want you to have that. Thanks for listening, and DM me for the link. Bye.